Yep, go.
My name is Susie Arrendell. I'm the neuroscience ICU nurse manager, but I'm also a student at UTA, the Nursing Administration Management program. This is one of my courses that I'm taking, 5309, and I'm about to do a demonstration on case studies for students that are here in the classroom that are either new grads or fairly new nurses coming into the neuroscience ICU or the critical care area. The topic that we're going to do the case study on is acute ischemic strokes, and specifically left middle cerebral artery strokes, which is the more common type of stroke that most people have. The strategy that I've chosen, which is case studies, will be used to strengthen your critical thinking skills, problem-solving skills, and decision-making abilities. As far as the critical care setting is concerned, this type of teaching strategy just works well for this environment. So like I said, the intended audience is new nurses or new to the critical care areas. The cognitive learning theory is the theory that I've used to promote this this teaching strategy. It more incorporates perception, thinking, knowledge, representation, and memory. It will allow nurses to answer case study questions individually, going through these scenarios, and then we'll kind of look over them as a group. The environment is the critical care classroom at the Medical Center of Plano. I will be looking over these case studies after you've completed them and grade them. I would like to see a pass rate of at least 80%. We do have a huge patient population of strokes here at the Medical Center of Plano, so it'll be important information for you to know in your practice. So if you don't mind, go ahead and begin your case study, and we'll look over them as a group after you're finished. Okay, I guess. Okay, the group has had a few minutes to go over the case study and write in some answers, and we're going to go over it as a group. If you don't mind, we'll start at the front and just tell me what your thoughts are on that first question. What's the significance of the onset of the patient's symptoms?
They need to know what time it happened, because you've got that 4.5 hour time window to be eligible for TPA based on the onset of witness symptoms.
Okay, so the last known normal is what we were looking for, and we have a specific time from her, so that's good. Okay, go ahead. The next one, how does this past medical history impact his care?
Well, hypertension, diabetes, his increased lipids are all precursors for stroke. Not to mention that he's not taking his medications, so he's not well controlled. Everything's a risk factor. It impacts his care because once you can actually see how he's going to result with the medications, you can decrease his risk factor. You can get him back to his normal baseline.
Very good, thank you. If you don't mind, Carla, do the vital signs need to be addressed? Anything there that you see?
Yeah, it looks like his potassium is negative 4.0. Is that, am I correct in reading that?
It's just a hyphen.
Okay, I'm gonna say if that's negative 4.0, then he really doesn't need to be on Lasix. He needs to be on a potassium-sparing diuretic.
So as far as his vital signs, what
His
sticks out?
glucose is high, and he's not on any kind of insulin or diabetes medication.
How about one more thing on his vital signs? Vitals.
Oh yeah, his BP is extremely high.
Okay, and what might be something you would want to start on him? Is there any kind of drip? Anybody?
Cardigan.
Okay. Get it down. You don't want to get it down too fast, but a little cardigan would help ease that down a little bit. Okay, what's the significance of the normal CAT scan of the head?
If there's no bleeding, it's not hemorrhagic, use a candidate for TPA.
Yay. We would want to give him TPA if that CT of the head is negative and in a timely fashion too. So, Liz, as far as administering TPA, how might that impact his care? What are some things you might look for?
Well, since he came in within the 4.5 to 3 hour window, he can receive it IV. And then I would watch him for signs of hemorrhage.
Okay. Bleeding is the big risk factor that you might have with that. Julie, I'll come back to you. How will you care for this patient when he comes to the neuro ICU?
You'll do your Q hourly neuro checks for him, and make sure you're assessing his pupils. You're still gonna monitor him for any bleeding, any hematoma sites, monitor his mental status changes, because they're at high risk for bleeds during the TPA and after.
Okay, very good. What are the most important discharge instructions he might need?
We want to make sure that he knows signs and symptoms of stroke, just because his incidence does jump up quite a bit. Medication administration, make sure he's taking it. Compliance is basically his best defense against another one.
That'll make a big difference for him if he takes his blood pressure medicine, and stays on his anti-cholesterol, his cholesterol lowering medication also. So Carla, do you anticipate that any of his medicines would need to be changed? Do you think it's maybe a change that he needs, or what might it be that he needs?
He needs to be compliant first of all, and then he needs to be compliant on his medication, and then depending on how the TPA, I guess you would anticipate maybe rehab for him, depending on how the outcome of the TPA is, and then, what does it say, he weighs 100 kilograms, so he's overweight, he needs diet and exercise.
Okay, very good. Those are that's great input for this type of patient, which, as you know, we see this type of patient pretty regular in the ICU, and then they move on out to the neuroscience PCU, and then would go to a rehab facility once they're discharged from the PCU. So I appreciate y'all's participation in the case study. Thank you.
Well,
Thank you.